So I'm going to show you also the face, no, in our plastinated specimen. This specimen looks better because dissection of the specimen starts, no, when it was still quite fresh, no? Unlike our very dehydrated cadaver, no, who spent at least, no, 6 hours in tank, in formalin tank. So for the plastinated specimen, no, brief history, no, how the specimen are processed. So the company has pre-identified the donors, no? They carry with them a donor card. So when they die, no, the company can be notified right away, no? And within 24 to 48 hours, no, they can be transported to the plastination facility for preservation, no? And for initial dissection. So dissection of structures, no, is not as difficult, no, as dissection of very dehydrated structures, no. Lots of connective tissue are easier to break, no, and they are still well hydrated. Also the coagulation, no, that takes place when cadavers are preserved in formalin solution for long periods of time, no, there will be coagulation of proteins, no, and that will make connective tissue structures more tough, no, and more difficult to break, no, and dissect. So as you can see, and the muscles here, by the way, are also painted, no, and highlighted. You can see the orbicularis oculi right there, no? You can see fibers of our levator labiae superioris alaquinacea, our levator labiae superioris, no? So zygomaticus muscle, no? But the muscle fibers of for zygomaticus major and minor, they are not clearly distinct, no, or separated here, no. Depressor anguli oris, no? We have depressor labiae inferioris also, muscle that pulls down the lower lip. And then we have part of the rhizorius, no, still visible right there, and also clearly visible here, no, are the branches of the facial nerve, no? Branches of the facial nerve, no? After they pierce, no, the substance or the mass of the parotid gland, you can see them, no, going to the different facial muscles there, no? So the large branches of the facial nerve again, no? You have 5 large branches, no? What you can see right here are the smaller, no, branches coming from the large branches. The large branch, we have again, no, temporal branch, zygomatic, buccal, mandibular, and the cervical branch, no? So again, you can see fibers of the main branches, no, as they go and supply, you know, the different muscles for facial expression right there. Again, for the sensory nerve supply of the face, that is the job of our trigeminal nerve. So I think I forgot to mention this, no, in the cadaver. So an important landmark here, no, in the area of the lip, no, we have the vermilion line or vermilion border. What is this vermilion line or vermilion border? It's the junction between the skin that covers the lips, no, and the mucous membrane, no? So this line that we can see right here, that's the vermilion line or vermilion border of the lip. Now this is mucosa already, no? Mucosa of the lip. Now, what type of mucosa is that? That is still stratified squamous keratinizing type of epithelium, no? But it's histologically different from the skin, no? The glands present are different, no? And there are other histological differences as well, no? So when there are cancers, no, so the histotype of tumor, no, may be different, no, if your cancer is growing in the mucosa versus the cancer that grows in the skin, no, that covers the upper or lower lip, no. So upper lip actually is a common site, no, for skin cancer formation because it is exposed to sunlight, no. We can also see the facial artery right here, and you have the submandibular salivary gland right there. So